Thank you, Ted, for your kind invitation and to all the panelists and to organizer of this meeting that make me a great honor to be here among a distinguished panel of scientists. So, as I apologize because I will have to leave earlier due to university teaching commitments, and so I will directly share the screen in order to show what is the problem and how we try to solve this problem of the long COVID syndrome in Naples. So I hope you can see my screen. I hope I succeeded in sharing the screen. And okay, yeah, don't just a second. Okay, so just to make recapitulate what Theo just said, is the long COVID syndrome is considered a new ontology, a new condition that derives from the persistence of the symptoms of COVID after the patient is actually healed from the COVID infection itself. Usually these symptoms include fatigue, cough, those are respiratory syndromes, but they there are also some patients that complain about pain, fatigue, and disturbance of the cognitive function. Indeed, the percentage of patients that suffer from this condition is estimated about 30%, which makes the numbers becoming immediately huge, and this is going to be a sort of new emergency for our conditions, for our patients, given the fact that the number of infected people around the world it's huge. So it's considered that about 700,000 people just in the United States will suffer from the long COVID syndrome, that essentially makes this a new chronic condition that is characterized by the symptoms that I explained before, and that necessarily needs to be tackled in a setup that is the setup of the outpatient clinic. So these patients are back on their homes, but they need to be managed from the distance. And it's interesting that so far there are not so many therapeutic interventions that have been described to be able to manage this condition. And but the fact that there is the breathless and the problem with the fatigue make this condition suitable for interventions that includes rehabilitation more than drug treatment. Therefore, the proposed management of long COVID syndrome right now is very close to an integrated care approach, where you bring together interventions that are made in the hospital and that are continued in the territorial setup, using both pharmacological and non-pharmacological approaches, including the rehabilitation programs in a manner that is that has been utilized by proposed by the European Innovation Partnership on Active and Healthy Aging as a suitable management of chronic conditions that is a good alternative to hospitalization of patients. So we introduced in these patients the scheme of the management schemes that we have been using in the past for the rehabilitation, cardiovascular rehabilitation in particular. So cardiovascular rehabilitation can be done in the hospital during an early intervention during the acute phase in the hospital that can be continued until after dismission. And then there is the long-term support that is supported by lifestyle changes and maintenance of an adequate level of physical activity. It's interesting to note that while the hospitalization requires that the intervention also the rehabilitation intervention are made by healthcare trained personnel like a physical therapist, you can support long-term lifestyle changes using the prescription of physical activity that can be done by physical trainers, not only by therefore personnel that is not healthcare personnel, but is a personnel that has been trained for the maintenance of the well-being. Recently in Italy, we have had a recent law that is called the Riforma dello Sport, Sports Reformation, that give the kinesiologists, therefore the laureate in the physical activity laureate, the role of the professional that maintains and recovers the best conditions of physical well-being in the general population through the promotion of active lifestyle. So we took opportunity of this specific personnel to apply to the long COVID patients that were referred to our clinic for an intervention that allowed us to maintain the well-being of these patients also at home using interventions that are not properly rehabilitation intervention, but rather physical activity prescription that is performed through the means of physical trainers and the means of an ICT supported solution. The flow of the process is indicated here. So essentially, at the time the patients access the outpatient clinic for the prescription on physical activity that I direct at the Federico II University Hospital, and at that time, these according to the American College of Sports Medicine guidelines for testing, exercise testing, and prescription. Sorry. Okay. We do the evaluation, the assessment of the physical needs of the patients, including the tolerance to stress on the cycloergometer. At the end of this assessment, there is the prescription of the physical activity, indicating where the intervention needs to be directed on the muscle levels, on the balance level, or the tolerance to stress. And at this point, it depends on whether the patient is independent enough to go and join classes that are directed by physical trainers that have been selected for this specific program, that have the competencies for this specific program, or rather they can receive an intervention that whether if they are less independent and need more support at their places, this we prescribe the activity, the exercise that these patients have to do on their on a platform that is accessible through an app that is downloadable on their cell phone. On a daily basis, the patients receive information regarding the exercise that they have to perform, even videos of the exercise that they have to perform, and they do the exercises. And in this way, we can also follow their adherence to the prescription. At the end of the process, the patients are recalled for reassessment and evaluation of the progress that they are made. Our results are very, very supportive of the reintegration of the effect of the physical function, the physical activity of these patients, with a beneficial effect, in particular on the tolerance to stress, and therefore to the feeling, to the personal feeling regarding the activity, their daily activity, with amelioration, therefore, also on the cognitive function, in particular on the humoral the humoral perspective of their daily life. And we propose this on a large. We propose this because it's an intervention that can be done on a large scale, not just to few interventions like it would be if we had to have one by one physical physiotherapists interacting with these patients, and therefore is also sustainable and can be proposed as a public health intervention. This is what I propose to your attention, and once again I thank you for your invitation and the possibility for me to illustrate our program here in Italy.